Today is day one of Nurses Week, and I was supposed to do this video earlier, but I got busy and I could not do the video, so I'm doing it this late. So hello, I'm not Bayesan, and I'm a competent nurse. Yes, I'm that proactive nurse. So I see a lot of comments, a lot of posts about nurses, and it's always very tiring and painful that even we with nurses, the ones that are hardworking, they don't get their flowers. I don't know, people are always quick to run online and complain about a bad situation. I, I barely see posts about, oh, I was admitted in so and so hospital, this particular nurse, her name is this, or even if you don't mention the nurse name, say, this nurse was so nice to me, she did like this, she knows her work, or he knows his work, he's very hardworking, he's very professional, he knows what he's doing, and all. But once enough just misbehave, people are running to social media, quick hands, typing, haba now, haba. This is nurses week. Appreciate nurses. When you say a good nurse, appreciate the person. It's not easy to take care of sick or well people. It's not. But these are people that dedicate their time. Nigeria don't pay us well. I don't even think any place, home and abroad, they pay nurses well. It's just something okay, let's just manage, let's just do the work. Because even the abroad that they're saying Nigerian nurses are all relocating to the old Japan thing. They are nurses like UK nurses, UK trained nurses. They are relocating to another country. So what is it? They don't pay nurses enough for the work they do. So when you see a good nurse, you experience a good nurse, please and please appreciate the nurse. Yes, we have a code of conduct and some hospital policies that say do not give nurses gifts, do not give your caregiver anything, please. But word of encouragement will go a long way. You could also place that nurse in higher positions. Yes. And yes, so don't get me wrong, there are actually bad nurses out there. It's not enough being a professional nurse. Some nurses are ill-mannered. This thing is not just at workplace, it started from school. If nurses can be truthful to themselves, you had colleagues in classmates that were hell of a trouble then. Your own colleagues, like they snitch on you to lecturers. When you go for clinical, they snitch. They always not liking work. They're trans, they come to work late. It's there. It's not like they don't develop that character from nowhere. That is who they have been. They've been that way. So I don't think it's something they just develop or they just picked from somewhere. No, they didn't just pick it from somewhere. It's something that has been there. My colleagues, people should do well. Try and change. You were called to serve humanity. Please change. Anything that is worth doing is worth doing well. Because I really don't understand. Even if I know some private sectors, let me say, I used to say private sectors is just like same job, minor differences. Because I say minor differences because there are some policies that are flexible and staff welfare that is nice. So just same job, they want their money, they're all about their patients and all. But then again, I know it's your work, it's your profession. You have a license. You were paid to do a job. If you don't want to work for that organization, my dear, resign. Yes, drop your resignation letter. Instead of staying in that hospital and becoming a nuisance. Instead of staying there and causing harm to innocent patients. Instead of staying there and giving the profession a bad name. Yeah, that's why I say, once you are not comfortable with a policy, it's your license. You were not trained by the hospital. My dear, tender your resignation and leave. Instead of causing havoc, instead of giving the profession a bad name. Because by the time you see people work for a private sector for a very long time, and when they've been there for long, so they get to, let's say, too used to the place, or let me say familiarity. And normally familiarity brings content, because I know boundaries. I'm not familiar. Yes, I'm not familiar with my friends. I'm that professional with my patients and my co-worker and bosses. I don't like familiarity. So when they've stayed in the system for so long, they become so familiar with the system, and it's not just them being familiar with the system. They start compromising their standard. Why? And most of them, they're in that system, the private system, for so long, and you're opportune. So I used to say it's compensation plan. Yeah, because most of them, some of these ones, they don't even improve themselves again because they just found one private hospital that they just want to relax and enjoy themselves. So since they're the oldest nurse there, so the management may just consider, okay, it's just right. They don't want to hurt the nurse feelings. It's just right that since she has been with us for a long time, she's the oldest, okay, we should give her the head nurse. Nursing is not handwork. Nursing is a profession. We have code of conduct. We have ethics. We have procedures. Yes. And you see, most of these nurses, they are not up to date. They don't know their onions. They don't even know what they are doing. They don't know their procedures. Yes. Now they're now supervisors. They'll now start discouraging. They'll now start discouraging the young ones, the ones that are doing well. Now they'll now, instead of trying to make the profession a better place, instead they'll now be working with the top management. Instead of making reforms in the system, they're working with top management to punish nurses, to blame nurses. Yes, they don't even do situation analysis. There's what they call situation analysis. Most of them don't know it. If any issue happens, how managed you could have, you shouldn't have, haba, my dear. We need to do better. Yes, this is Nurses Week. We'll start carrying play card, dancing, celebrating ourselves. It's nice. We've been doing this for years. I don't think there's anyone that celebrates Nurses Week like me. Like if I start working in a place and they don't celebrate Nurses Week, I'll make sure they try to celebrate it, because I don't know why I'll be in a place and I won't be celebrated as a nurse. Yes, I'll be celebrated because I do my job well. Please, wherever you find yourself, even if the system is frustrating you, as long as you've not gotten another place that you like, that fits your own core values as a nurse, please manage, do your nursing job, do your work, render care, the care you would have given to your own self or to your relative. Anytime you want to give care to anybody, think that, okay, if I'm the one in this situation, this care I'm giving, will it be okay another person giving me that care? I say, render the care you want someone else to give to you. Render the care you want someone else to give to your relative. Because, my dear, life happens. You may see yourself on that bed tomorrow. And karma happens, yes. I don't wish anybody bad, but men, as nurses, we need to do better. They taught you procedures in school. They taught you ethics and etiquette for you to make use of them, not just to write exam and pass. The exam was just, okay, let me say, like a validation to get your license. So now, okay, you're a competent nurse. You're now a professional nurse. You're now identifying the body. The difference between you and that quack, because I'm not even going to use that auxiliary or put anything else to their name, because they are quacks. The difference is that you know your scientific rationale. You know the reason why you're giving injection in the left outer quadrant. You know it. They don't know. They just thought, okay, give like this, give like this. I'm seeing a lot of videos. They are saying that they can set line, they can do this, they can hello, blah blah blah. People are quacks. As long as you don't have your license, you're a quack. Take it from me. You are a quack. If you like, know how to do all the nursing procedures. If you like, let the registered nurse, the professional nurse that is there, come to work, sit down and press her phone from morning till night. And you want to use that opportunity and say, you're the one doing all the work, carry your shoulder, you're the one that do the work, you know how to do the procedure. This nurse don't know anything. My dear, you're still a quack. If you like, be able to deliver skilled delivery, everything. If you're not a registered traditional birth attendant, you're a quack. You're not a midwife. Yes, take it from me today. I know a lot of you will not like it, because before this nurses, people have already started doing better body. Today I'm entering everybody. Everybody's collecting my hand. And please, employers, please, we the nurses in the private sector, please treat us well. We are not machines. We are human beings. We are people's daughters. We are people's wives. We are people's mothers. We are people's sisters. We have relatives. Most of us come from good homes. Yes, most of us have good homes. We came from family. We are loved at home. So when you see us at work, don't feel, this one is less privileged. I don't feel any nurse is less privileged. Because people, like in private sector, once they see you, they feel we are less privileged nurse. Yes, sometimes we work so hard and we look homeless. That's why I tell a lot of nurses, take care of yourself. Look good. When you are working, morning or night, look good. Don't look unkept. Because as you look unkept, patients can easily rate you like that. Because normally some patients don't have manners. They don't have morals. They are very condescending. Yes, so we have nurses that are very crazy like that. But some patients, even the calmest, the nicest, the most gentle nurse, they'll still look you head to toe and still talk to you in a very condescending manner. They'll still look at you head to toe and look at you and send you one useless job as if you are their maid at home. They forget that. They are like, this is a profession. I'm on uniform here because I went to school. I wrote exams. I passed. I had my license. I looked for a job. The hospital did not just pick me and say, come and help us and take care of this patient. Or you did not employ me in your house. I'm working for someone. You have your place of work. This is my place of work. Don't look down on me because I'm wearing a scrub. Yes, some hospitals, their scrubs are not fine like that. But we are mandated to wear like that. Don't look down on me because my scrub is bigger than me. Or my scrub is too tight. Haba. Be nice to nurses. It will not take you anything. Be nice to them. If If a nurse does something that you don't know, that like you don't like, I think they have a line manager. Please request for their supervisor or request for the most senior on duty. I'm talking about private sector here because I've not really worked with the government. I've not worked with the government. It's just that I was training with the government, but I have not worked with the government, so I can't say much about government. But I'll still say something about government hospital because I have been there. I've been a patient relative in government hospital. I'm coming to that one. I'm coming to people very well, and I'll hit people hard. But now I'm in the private sector because that is my area. That is where I have done all my experience in the private sector, so I know what I'm talking about. Patients know how to look down on nurses. Why? Because maybe I'm doing IDT and I didn't make up, I just hide my bare face. But if it's my bare face and this is my nurse's cap, I still look good. Because I don't know why. You'll be looking down on me. I'm like, okay. I'm not looking at me, you want to come and ask me to do something for you. That's my work, I'll do it. But my dear, I'll make you understand that I'm not less privileged. I come from a home. I'm loved at home. I'm somebody's child. So you don't treat people that way. Please, nurses. You know, I'll just say it, you know your drug administration rules. Make use of it. Make use of it. Stop. What taught you that butter behavior? What taught you? Yes, I know some private hospital doctors that run it to say, don't open drugs in front of the patient. Yes, I worked in a place that the doctor was telling me that. But I did not listen. I'll still carry the drugs to the patient front. Tell the patient the drugs I'm giving to them. Explain, oh, you feel like this, you feel like this. Tell them with the possible signs and symptoms, side effects they'll feel at that time, how it will react. I still see it. He will still come and still call me, but it's none of my business. When I was done, I knew I was done. I can't take that. It's my license. This is your hospital. If anything goes wrong, I'll be the one behind bars. If anything goes wrong, I'll be the one in court. By then, they won't remember. They won't tell me they won't hear the doctor said, because was it written down? No, verbal. It's gist. They'll ask you, as a reasonable prudent nurse, what are you supposed to do? I don't know. Me, I don't know how you could value your license. But the thing is, I value my license. Do you know how I studied in School of Nursing and School of Midwifery? Do you know I'm struggling? I'm still doing my BSc. I'm in the process. Do you know I'm reading to write my exams? Do you know the certifications I have? That I'll now come and be compromising my standard for anybody. I cannot compromise my standard. I'm sorry. You hired me because you saw me worthy. You hired me because you liked my CV. Yes. You were impressed by my performance. And you hired me. So I'm going to give your patients the best. Let the patient complain. It's still until the patient complain, and that I'm doing too much. But when the patient complains, I will still explain to the patient that is the standard, that is the quality. Yes. As a nurse, you need to be confident. Know what you are doing. Don't let people confuse you inside the hospital. It is not your procedure. It's not your procedure. Because you can do it does not mean it's your procedure. Don't let them rob you. Oh no, sir. You be feeling yourself. You are doing what it is. It's not your work. The day it happened. The day it happened, one mistake, that same person, but that same person have been hailing you. That, oh, you're doing well, oh, nurse, thank you, oh, nurse, my best, nurse, oh, nurse, you can do it, and you're feeling yourself. That same person will be the first person to rope you. They'll be dragging you, the way they will drag you. You know how they used to drag, it's not even tiger generator self. I don't even know how will I say drag self. You know when they used to do jungle justice, how they used to drag the thief. That's how they'll drag you. The highest they can do is just okay. They don't really indulge in the whole persecution, but they'll still go and say, who sent you? It's not your jurisdiction, so who sent you? So mind your business. Don't be too familiar. It is not your work. It's not your work. Know your work. Know your procedure. Know your procedure. Know your ethics. So when you say I'm not doing it, nobody can take you anywhere and win that you did not do it. Yes. Not that they're saying here. Okay, let me just do. My dear, know your work. Don't accept cheap labor. They pay you small to do the work. They now do substandard work because you're not paid enough. Or they're paying you small, then you're now giving you a stressful duty, a stressful shift. You have the right to complain about your shift. Yes. You have the right to resign. I'll still say it again. You are not pinned to anywhere. As long as you're working with the private sector, you are not pinned to anybody. Yes.